Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's go through what a pediatric exam looks like. Now Landry here is 7 weeks old. He's been getting treated for just a couple of weeks. And so we did a new patient exam on him when he first came in, but I want to show you guys exactly what that process looks like. Now Landry, as you can tell, is a real baby. He might cry, he might get fussy. So this video is going to look exactly what it looks like when we have a new patient come in the door. Now the first thing we do is start off with a consult, and we're going to talk through with mom and dad what exactly is going on. What did birth look like? What did that whole process look like? Do we have any troubles or any struggles? Are we getting any symptoms now that we're on the outside? All of those things are things we're going to start off with, and we're going to know going into our exam, which is what we're going to do with Landry. Now, we have an exam form just to show you guys what this looks like. It is 4 pages worth of tests that we're going to do. All of these tests are going to help us better figure out exactly what's going on with Landry and how his nervous system is integrating to life on the outside, because it's a lot different than it was 8 weeks ago for him, right? And so we'll work through this and we'll note when was he last fed, does he have a clean diaper, all of those things are discussed and touch base with parents. Also during exams, when possible, we'll remove the clothing and leave him in just his diaper. We're not gonna do that for this video, but that allows us to get visuals to see are his folds looking the same left to right under his axilla or in his hips, seeing those mobilities, seeing any weird birthmarks, all of those types of things. So we'll start off by taking their pulse. Now pediatrics, you'll take a pulse right here underneath the bicep. And so we'll have that hold there. I know, my hands are a little chilly. I'm sorry, buddy. And so with pediatrics, depending on what age they are, is gonna be within normal limits for what a pulse would look like. For him being that 7-week marker, he's gonna be somewhere between 80 to 160 is what we would consider normal for a heart rate there. And his is looking good, right? We're also then gonna watch his respirations and seeing how many times is he breathing per minute. Once again, gonna be different per age group. We'll then go through, we'll do what's called a grimace test. Grimace, we wanna make sure the baby can feel pain essentially. And so you're gonna watch his face grimace a little bit. We'll push on the bottom of his foot and he'll make a little bit of a grimace or a fuss at me and kind of tell me, hey, that hurts, which is exactly what we're wanting to see. We're not hurting the baby, but we're making sure that that signal from his foot is going to his brain back again. We're gonna look at his head and we're gonna see and make sure, are there any asymmetries left to right? Could that be something that happened during birth? Has it gotten worse or better since birth? We're gonna watch for tone. Is he looking straight forward at me? Is his head constantly tilted to one way or the other? We're even gonna take a few notes and notice, does he have symmetry? Hi buddy, you give me a good smile. Does he have symmetry around the eyelids, around the eyes, around the nose, around the mouth? Collecting all of this information as we go through and then checking them off as we go, so we have these notes to refer back to and look at this in the future as well. So as we make it through our other pages, we're then gonna move into other tests, like this one here where we go pull to sit. And so we're gonna put my thumbs directly in his palms, which is a palmar grasp. We jumped ahead a little bit. And then we're gonna look to pull him up. For him, because he's only 7 weeks old, I'm gonna have my hands under his shoulders and pull him up and watch what his head does. Now for him, his head lags behind that whole time. As a newborn, he shouldn't be able to hold his head up all the way. But we do wanna start to see that as we lift him up, he'll pick his own head up and feel that weight and start to do that. This is one that we see a lot and surprise a lot of parents with. When that baby comes into the office or they come home from the hospital the first time and they go and they're like, my baby can hold their head up already. He's only 2 days old. And we're gonna tell them that's not necessarily a good thing up front because they're hypertonic or too much tone. Some of our other videos on this page, we're gonna talk about things like torticollis and the tension in those muscles and some of the side effects within that and how that can create some long-term effects. But those are the type of things that we're looking at are his tone. Now for Landry, he doesn't have any interest in picking his head up. And so for right now, we would note that as a hypotone, decreased tone. He's not wanting to pull his head up forward. So as we treat, that's gonna be a metric that we're gonna continue to watch, that he's falling within those normal markers and we're seeing his head start to pick up a little bit better on his own, right? We can monitor those things. We will do what's called scarf sign. We take their arm and pretend like it's a scarf and we pull it across the body. The elbow should be right towards midline on both sides, right? If it comes too far across, that means they have hypotone, or if they have too much, or if they don't come far enough across, it's hypertonic, right? Too much tension or not enough tension, right? And so we're doing that on both sides, yeah. We pretend like we're boxing too, huh? Yes, we do. We're gonna do heel to ear, pretending like the baby telephone, where they pretend like their foot is a phone, right? This one we're looking for symmetry on both sides, which we see with him that they're both coming up. Some babies can get it all the way up, some cannot. We're not so stressed about how far with that test, just one side versus the other. We're gonna check his popliteal angle. Your popliteus is this muscle back here. And so we bend him up and then try and extend that leg. We want to see this angle be somewhere between 90 and 120 degrees. Once again, we're checking the tone, the tension within his muscles. Does he naturally have too much tone, not enough? Where is he at? We did palmar grasp where we put our hand right in there, or put something right in their hand and they should grab it. That's a great one to do for your toddlers at home. Have the toddlers do the baby love test where, look, I put my finger in his hand, he grabbed it, he loves me, right? That's a great way to get your toddlers involved with these, and we'll do it when mama brings in the whole family. We also want to see what's called a plantar grasp, where we can see is I put my hand right in the middle of his foot and his toes will start to curl around it. He's trying to grab with his foot. A great reflex to have now, but one we should see go away as he starts to walk. So good examples of when these come and go. Also watch for a Babinski's response. Bless you. Yes. You got any more? Okay, good. So we'll do that Babinski's response where we're kind of watching his toes flare. It's kind of like we're tickling the bottom of his foot. Once again, sending that signal to the brain and back again for these reflexes that should be there. We'll also use a coronal suture measurement. We'll grab a tape measure. I didn't come prepared, I didn't bring one with me. But we'll measure from the front of the head out to the side and then to the other side. Comparing those sides to see, is the cranium one perfectly round? Is it deviated one side or the other? And that tells us we may need to do some cranial work. That one, interestingly enough, can affect their latch and how they're breastfeeding if we see an imbalance within that, super common, as well as then correlating back to those, what we see on the lateral eye there and the creases there. We'll look for a rooting reflex. Rooting reflex is one that's more common or more known at this point, where we stroke their cheek and he should be looking for a nipple, right? He thinks there's food there. Now, he is not having it today. Now this is one that goes away pretty quickly. That's one of the first ones that starts to go away. That's somewhere between 0 to 4 months. It should be there. For him, it's not there at all. So that's one that's already either went away too quickly or isn't integrating quite right. So we're watching for those timelines. For example, if Landry was 8 months old, 9 months old, 10 months old, and he still had that rooting reflex, that's a positive test or a test that we're saying, hey, something's wrong there as well. So it's important as we go through to remember that some of these should be there for certain time periods, some should be gone later. Yes, tell me I will hurry up, I'm sorry, right? We'll also palpate his palate. We'll throw a glove on and go through his mouth, doing a few other tests there as well. Sometimes as they get grumpy, right? We'll pick them up and we'll go through different ways, right? So I'm gonna jump ahead a couple of tests because he's a little grumpy with me at the moment. So we'll go through and we'll palpate. And part of our exam is gonna be palpation all the way up and down the spine, where we feel every single segment to see them start to feel restricted, tight, or taut. Sometimes baby will squirm into those and he'll see that that's a little tender for them, indicating that there's a subluxation there and an issue at that segment specifically. The last part of our exam, we'll lay him back down on our belly. We'll see if he'll participate. If not, we'll move on to it later, right? And that happens during our exams where babies get tired of it. They get frustrated. You're gonna let go, buddy? Thank you. Or they get a little frustrated. So instead of laying him on his belly on that mat like we traditionally would do for an exam, we can finish it right here, where I'm still got him in a nice steady hold. He's held, so he's a little bit happier. And we'll stroke up and down the spine here. So we'll do some spinal gallant. We'll do a few other testing as we palpate through each one of these segments. So hopefully this shows and takes some of that confusion or some of that fear you might be seeing with the pediatric exam. They're super simple, they're super basic. And no, they don't always go exactly according to plan, but that's okay. We're gonna meet you where you're at. Find ways that we can still serve you and your family, get you the information you need, and figure out how we can get you functioning the way you want to, right? Figure out how Landry can get the wins that he needs to and wants to get. So if you want to know more about what this pediatric process looks like, or more in depth on what that would look like for your patient specifically, come on in, let's chat about it.